Hi, Dr. Malka here. Today I'm going to show you how to self-treat jaw pain or TMJ dysfunction with self-massage, stretches, and exercises. Pain in the joint of the jaw can be caused by clenching or grinding. In fact, I had a patient one time who was chewing too much bubble gum and she couldn't open up her mouth. And because this syndrome is commonly caused by stress, I recommend that you practice relaxation techniques, especially before bed, in order to fall asleep in a calm, relaxed state. Because the mental state you fall asleep in can follow you throughout your sleeping cycle. So the muscles involved in TMJ dysfunction or jaw pain is this muscle right here, the masseter. It connects from the cheekbone down to the jaw, and the temporalis muscle. Both of these muscles too can refer pain into the teeth. This one here, the temporalis, can refer into the teeth. And I had a patient at one point who had a cavity filled, only to find out that the pain was just referral from the temporalis muscle. So let's begin with self-massage. So we're going to start with this masseter muscle. You want to make kind of knuckles like this or your open fingers and come in. I'm going to use my knuckles, it's easier for me. And because the fibers go up and down, you want to place the hands here and go back and forth along that muscle, dropping off from the cheek up at the top. And you're not going to slide across the skin. You're going to it's very small movements. You're just going to use the skin to slide across the muscle. And then come down 1/4 of an inch, back and forth along the muscle. And then wherever you feel tightness, the tightness will vary from person to person. You just kind of stop and press, make circular motions, and then continue down the whole length of that muscle. Once you feel like it's not too tender to touch, I'm going to have you then stretch with the muscle in a stretch. So you're going to open your mouth and then begin the same procedure again, back and forth. While your mouth is open, it needs to be relaxed as well. Across the muscle fibers. So now that was the masseter muscle. You can repeat this 3 or 4 times for 30 to 60 seconds. The next muscle is going to be this fan-like muscle, the temporalis muscle. This kind of fans up and goes right along in this area. And this one, first with the mouth closed. Again, going back and forth across the muscle, pausing where you feel any tenderness. Come down. Come down. And then the attachment of this muscle is right here. And again, you could use your fingertips to massage or your knuckles. If you use your fingertips for too long, they might get a little tired. You can even use the inside of your palms like this to massage in circular motions or back and forth. And once again, to put a stretch in this muscle and massage, you're going to want to once again open up your mouth, performing the same massaging actions. Have awareness of these muscles if you ever feel them referring into the teeth, if you have one of those trigger points. So next, I'm going to continue with stretching. So you'll want to put your fingers on the inside of your mouth and just open up the mouth. Relax that way for about 30 seconds. Now I'm going to have you open up the mouth again, and if you've seen my other videos, you know how much I like stretching against resistance. I'm going to open the mouth, leaving it open. I'm going to slightly close my jaw. Relax, try to open it more. Now your pain might be so bad that you can barely open it. So I want you to do the finger test. So remember I told you about the lady with the chewing gum? When she opened her mouth, she could only open this far. And then as we started massaging and stretching, she could maybe fit 2 fingers in. So that's an important way to see your success as the muscles start to release. Then the next stretch I'm going to have you do is divert your jaw to one side and slightly push against your hand, not changing the range of motion. Pushing this way. And relax. We'll do the other side, just to relax that side a bit. And push. The other side, pushing for 10 to 15 seconds with only 10% of your strength. Other side, push. And then the other side, and push. So it's a combination of stretching against resistance, where you're stretching and creating little exercise motions at the same time. These can now be done static, where I'm just going to put my hand here on the side of my mouth and push against my hand. Relax, other side. Push against my hand. You can do this a little stronger now, maybe 20% or 30% of your strength. Repeating it 3 times. Push. And you can always pause this video if you feel like you want to do longer stretches or exercises or even the massage. And then push, repeating 3 times. Push. And then push. And then the final exercise will be to put your fist under your chin and to just, as if you're opening up your mouth. And push against your fist. Or if that's a little uncomfortable, you can put the soft padding of your hand and push. There's another aspect of TMJ that needs to be addressed. People will come in with forward head carriage. When you have forward head carriage, that can also oftentimes put stress on the jaw. So you do want to make sure your head is back and in a straight posture. So the stretch for that, the next stretch, is to put your hands behind your neck and just push against your hands with your head, jutting your head back or pushing your head back. Your ear should be aligned with your shoulder. So if your head is forward like this, that could put pressure on the jaw. It's all about posture and good postural exercises. The final massage technique, and this is a little more advanced and maybe you'll feel a little uncomfortable to do this, it's to put gloves on and to come inside the mouth and massage that masseter from the inside. So it's basically going in as far as you can with your finger and then grasping the cheek between your finger and your thumb, like so, and massaging back and forth in an up and down motion. So like this. And you can even close your mouth if you want. And massaging here with the thumb and the finger. You can start up high, drop it down, and drop it down. And then you can come back up. Even sometimes I'll do a pulling motion. And when you're doing this, you want the thumb on the outside, the finger on the inside, because the finger's smaller. So the other side is, again, just grasping that muscle, going into the mouth as far as you can, in and up. Grasping the muscle. Massaging it, up and down, or even back and forth. Up and down. Back and forth. And pausing when you feel pain and just holding it. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos. To allow me to make more videos for you in the future, please press the subscribe button, press the notification button so you don't miss a video, and press the like button, and be sure to share with your friends and family.